Prior authorization does not just delay care, it delays revenue, and when it fails silently, it creates claims that come back denied weeks after the patient was already treated. For front desk staff and office managers in outpatient PT, this is one of the highest stakes administrative workflows in the clinic. In 2026, the rules changed. Here is what your team needs to know. The single biggest source of confusion in PT prior auth is the difference between traditional Medicare Part B and Medicare Advantage. Traditional Medicare Part B, the federal program auth, does not require prior authorization for standard outpatient PT services. Your evaluation and treatment can begin without approval. The coverage mechanism is the KX modifier at the $2,480 threshold, not a PA system. Medicare Advantage is different. These are private insurance plans, and they operate their own prior authorization rules. As MA enrollment has grown to cover roughly half of all beneficiaries, prior auth requirements have expanded significantly. Almost every MA plan requires authorization for outpatient therapy. Billing a patient with an MA plan the same way you bill traditional Medicare Part B is one of the most common and most avoidable denial patterns in outpatient rehab. For any patient with an MA plan or commercial insurance that requires authorization, here is the workflow your front desk should be running. Step 1. Verify before the eval. Confirm the patient's insurance and check whether their plan requires prior authorization. Step 2. Submit after the evaluation, before treatment. The initial eval itself typically does not require PA, but treatment does. Submit the PA request with ICD-10 codes, planned CPT codes, and the plan of care with functional goals. Step 3. Get the authorization number and put it on the claim. Once approved, that number goes on every claim for the authorized period. Missing it means denial at submission. Step 4. Track visit count against authorized amount. The authorization is not open-ended. It covers a specific number of visits over a defined period. Running out of authorized visits without submitting for renewal is what creates the auth cliff, the visit that is rendered and then denied because the window expired. CMS finalized new prior authorization rules under CMS 0057-F, effective January 1, 2026, that apply to Medicare Advantage and Medicaid managed care plans. 3 changes directly affect your workflow. Faster decisions. Payers must now decide standard PA requests within 7 business days. Urgent requests must be decided within 72 hours. Second, specific denial reasons required. Vague denials are no longer compliant. Payers must now state the specific reason for every denial. That means you have actionable information to appeal correctly. Third, public denial reporting. Payers must now publish their PA approval and denial rates annually. Use this data to evaluate which plans in your payer mix have the highest denial patterns. In outpatient PT, the majority of PA-related denials are preventable. They come from 4 workflow gaps. 1. Providing treatment before authorization is confirmed. 2. Submitting an incomplete request, missing ICD-10 codes, CPT codes, or a functional plan of care. Vague goals get denied. 3. Not tracking visit counts against authorized limits. The auth expires, the clinic keeps treating, and the denial arrives 6 weeks later. 4. Not appealing. This is the most expensive mistake. More than 80% of Medicare Advantage prior authorization appeals are ultimately overturned, but fewer than 20% of providers consistently file them. Prior auth tracking, submitting requests, logging numbers, monitoring counts. This is where manual workflows fail at scale. Spry is built for outpatient PT, OT, and SLP. Prior auth management is built into the same platform as documentation and billing. CAM Physical Therapy processed over 5,000 authorizations through Spry, with a 97% first-pass approval rate. More at script.com. Subscribe for billing and clinical operations content built for U.S. rehab clinics. Questions about prior auth workflows, specific payers, or denial appeals, drop them below.